Hi, my name is Taylor Ho, and today I'll be presenting on measles. So first, I want to start off by explaining a little bit about what measles is. Its more formal name is rubeola. It's also commonly known as red measles, 10-day measles, or coughing measles. It is an acute viral infectious respiratory illness that is caused by a negative single-stranded RNA virus that is part of the genus Morbillivirus and the family Paramyoxvirus. Right here you can see this is a 3D rendering of what the virus looks like. So it is an enveloped virus that is contains two membrane enveloped proteins that are responsible for fusing the virus in the host cell membranes. It also is how the virus is able to penetrate the cells, and then the measles virus also only has one serotype, and it only targets one type of. There's only one antigenic type of measles virus. So its most closely related relatives would be the rinderpest and canine distemper viruses. The rinderpest virus is also known as like cattle plague, and since it primarily infects like buffalo and cattle. And then the canine distemper viruses are highly contagious diseases, viral diseases of like domestic dogs, ferrets, um, and raccoons. It's incurable, and it's very often fatal. That affects the respiratory, GI tract, and the central nervous system, kind of similar to how measles affects the body. So, a little bit about the history of measles. So, the measles virus was believed to have originated from cattle in the Middle East centuries and centuries ago. It was due to the close proximity and large amounts of times that cattle herders spent with their cattle, and they believe that this is how the virus was transmitted to humans. And then in the 7th century, that's when the first written account of measles was written by a doctor named Rhazes. He tried to distinguish between measles and smallpox, but was unable to. But he did state that measles was going to be a more dreaded disease than smallpox. And then in 1740, Frederick Hoffman identified measles virus. And then in 1757, Francis Home was able to detect measles as an infectious agent in patients' blood. And then in 1912, the U.S. made it mandatory for all diagnosed cases of measles to be reported, as it is a highly contagious and infectious disease. And then in 1963, the measles vaccine became widely available to the general public. And then in 1968, a new and improved but weakened measles vaccine became available after there were some adverse effects seen in the first measles vaccine that was introduced. And then in 1989, a second dose of MMR vaccine was recommended after outbreaks among vaccinated school-aged children, which led the American Academy of Family Physicians, the American Academy of Pediatrics to recommend a second dose of the MMR vaccine for all children. And then from there, we were able to see a steep decline in the number of measles cases. And then in 2000, measles was declared eliminated from the U.S. Before the introduction of the measles vaccine, I guess you'd say the pre-vaccine era, major epidemics occurred approximately like every 2 to 3 years, and there was an estimated like almost 3 million deaths per year due to measles. So, a little bit about the transmission of measles. It's a very contagious infectious disease that is spread through direct contact with infected nasal or throat secretions. It can also be spread through airborne transmission. And then measles is also a human disease and is not known to occur in any animals, so the only reservoir of infection would be in humans. So, a little bit about the airborne transmission. Measles virus can live for up to 2 hours in the airspace after an infected person leaves an area. And as the virus remains active, it is still contagious. So it has been said that if one person is infected with measles, up to 90% of the people that come in close contact to that person who are not immune will also become infected. So measles has an R naught of 16 to 18, and it can be transmitted by infected people for up to 4 days before the onset of rash or 4 days after the rash erupts. And no asymptomatic transmission has been documented, but usually measles enters through the lower respiratory tract, and it can also enter through the nose. So, measles symptoms typically appear about 7 to 14 days after contact with the virus. Measles virus does have an incubation period of about 11 to 12 days. So, these are the symptoms that are most commonly associated with it. So, fever, coryza, cough, conjunctivitis, complex spots, and measles rash, which is the hallmark symptom of measles. So, the fever can reach as high as 105 degrees Fahrenheit, and then coryza is an inflammation of the mucous membranes in the nose, which usually causes a runny nose. The cough is usually persistent. Conjunctivitis, as you can see here, this is typically how it manifests in children, which symptoms of this symptom usually shows up about 2 to 3 days after symptoms begin. So it's red, watery eyes caused by an inflammation or infection of the conjunctiva in the eye. Complex spots are tiny white spots that are seen inside the mouth. These also occur about 2 to 3 days after symptoms begin. And then the measles rash consists of flat red spots that spread down the body. These typically appear about 3 to 5 days after symptoms begin, and it starts at the hairline, and then it spreads downward to the neck, then to the trunk, to the arms, legs, and feet. The measles rash can also have small raised bumps that appear on top of the red spots, and then the spots also sometimes can be seen as joining together as they spread from the head to the rest of the body. And the rash also causes a fever to spike even higher. And then other symptoms that are associated with measles would be diarrhea, vomiting, and ear infections. So, measles virus infects the macrophages and dendritic cells, and the virus is able to enter the cells through the CD150, which are surface proteins found on these cells, and then it invades the lung tissue and attacks the lymph nodes, spleen, thymus, liver, and skin. And there are 3 distinct stages of measles. So there's first the incubation period, which I just talked about, and then there's the prodromal phase, which is when there is the manifestation of mild symptoms, and then xanthum, which is a term for widespread rash, is when you see the distinctive measles rash start to arise. So this picture right here is depicting the measles virus infection cycle, and it starts off with the measles virus entering through the lower respiratory tract or the nose, and it travels to the host lung tissue, where it infects the macrophages and dendritic cells that are found in the host lung tissue, and then the infected cells are then able to travel to the lymph nodes, where it transfers the viruses to the T cells and B cells, which have CD150 surface proteins, which serve as the virus's entry point. And then from there, the virus particles are able to be spread through the bloodstream. And then this is how the spleen, lymphatic tissue, skin, and liver are all infected with the virus. And then the human body creates a cell-mediated response that creates measles virus-specific antibodies, and CD4 and CD8 T cell responses are created, and this helps contribute to clearing the virus out of the body, and also creates protection from reinfection as well. So measles is still considered a public health threat, as worldwide there are about 36 cases of measles per 1 million persons reported each year. In 2018, there were 140,000 deaths worldwide due to measles. And in the U.S. in 2018, there were about 1,282 cases reported in 31 states, which is the highest number that has been reported since 1992 in the U.S. There are still many developing countries, particularly in parts of Africa and Asia, where measles is still common. And due to COVID, there has been a kind of lag in the vaccination for measles. So this graphic is showing the number of cases of measles that were reported by year from 2010 to 2022. Currently, in 2022, there have only been 2 reported cases of measles in the United States, but there are some reasons why measles outbreaks are still occurring, such as an increase in the number of travelers who get measles abroad and bring it back home to the U.S. And then in the U.S., there are communities of unvaccinated people who contract measles and then are spreading it to others who are either unvaccinated as well, or those that are too young to be vaccinated. So in 2015, there was the Disneyland outbreak that led to a total of 125 measles cases. It started with an unvaccinated 11-year-old who visited Disney World, and the majority of those who contracted measles were unvaccinated, and a number of those were those that are too young to be vaccinated. And then in 2019, when we see the largest number of measles cases that has been reported since 1992, 13 outbreaks were reported, and 6 of them were associated with under-immunized communities that accounted for about 88% of these cases. So measles is typically diagnosed through physical examination symptoms, so they're usually looking for the hallmark rash that I mentioned earlier, and then an RT-PCR test is run on respiratory samples, so this could be a serum sample, a throat swab, blood sample, or urine sample, and then in the RT-PCR, it's looking for the measles RNA from these respiratory specimens, and then a serology test could also be run to detect the measles-specific IgM antibody in the serum, and this usually has to happen after collecting the serum within the first few days of the rash onset. And then molecular analysis is important to determine the genotype of the measles virus. Genotyping is important in tracking transmission pathways during investigations of measles outbreaks. So some complications of measles infections would be ear infections, diarrhea, pneumonia, and encephalitis. Encephalitis can often lead to convulsions, leaving children deaf or with intellectual disabilities. A rare but fatal long-term complication of measles virus would be subacute sclerosing panencephalitis. This affects the central nervous system, and it usually occurs about 7 to 10 years post-infection, even if patients seem to have fully recovered. And then some at-risk groups would be children under the age of 5 who are unable to be vaccinated, adults over 20 years of age, pregnant women who have not yet received their MMR vaccine, as measles can often lead to premature birth or low birth weight at birth, and then individuals with compromised immune systems from things like leukemia or HIV infection. So currently there's no specific antiviral treatment available for measles, but there is supportive care available with the World Health Organization recommending an oral rehydration solution and vitamin A supplements. So these supplements are for children, and they're given 2 doses 24 hours apart, helps restore the low vitamin A levels, and then also has shown to reduce the number of deaths due to measles. And then the supportive care helps reduce the severe complications, and it helps replace the fluids and other essential vitamins that have been lost. So the measles vaccine is given as part of the MMR or MMRV vaccine. MMR stands for the measles, mumps, and rubella, and the MMRV is the measles, mumps, rubella, and varicella. These are both live attenuated vaccines that are administered by subcutaneous injection. Some common side effects would be soreness, swelling, fever, mild rash, and temporary pain. And after the first dose, it's about 93% effective, and after the second dose, it's 97% effective. And overall, they're seeing a 99% reduction in the number of measles cases compared to the pre-vaccine era. So the best prevention method would be routine vaccinations. This is the best way to protect against measles. There is the Measles and Rubella Initiative that was launched to achieve the measles and rubella-free world by supporting mass vaccinations in countries where measles is still common, such as the parts of Africa and Asia that I mentioned earlier. And they also provide support in outbreaks such as contact tracing and treatment. So some future outlooks would be that zinc is currently being researched to see if it reduces the measles-related morbidity and mortality rate. The vitamin A treatment is being tested to treat patients as far as like the proper dosage is given. As measles is still a significant health threat, prevention and treatment of blindness due to measles virus is also being studied now. And these are my references. Thank you for listening, and I look forward to all your questions.